All right, good morning everyone, and welcome to this presentation about my engagement framework, Transforming Access to Services, Understanding Gender Diverse Youth's Experiences of Gender Affirming Care at Foundry. Before I begin, I want to sincerely thank Leah Lockhart, who supervised my practicum, my course supervisor, Dr. Mira Daber, and Julia, my peer reviewer. I raise my hands in gratitude to the Indigenous nations of the 3 places that have nurtured me throughout my life, which I've represented using the trio of photos on this slide. First, to the Okanagan Syilx, then to the Musqueam, Squamish, and Tsleil-Waututh, and now the Lekwungen speaking peoples. As a white settler, I'm committed to using the skills that I have gained through my MPH towards supporting the wellness and liberation of the Indigenous peoples of Turtle Island and beyond. For my practicum, I had the privilege to work with the engagement team at Foundry to propose an engagement framework that they could implement in the future. The goals of this project are to, 1, understand the experience of gender diverse youth receiving gender affirming care at Foundry. 2, to identify gaps in gender affirming care services at Foundry and recommend service improvements to better meet the needs of youth. And 3, to engage gender diverse youth as co-evaluators and researchers about services that impact them. Note that through this presentation, I use the term gender diverse to encompass the range of markers that young people may use to describe not identifying with the gender assigned to them at birth, including but not limited to transgender, non-binary, gender fluid, two-spirit, agender, or another term. For those who aren't familiar, I wanted to provide a brief overview of what the literature tells us about gender affirming care for youth. Multiple studies in North America have demonstrated that accessing gender affirming care, which is any care provided to an individual to support their gender identity, can have positive impacts on the mental health of gender diverse youth. This is important as gender diverse youth have a disproportionately high rate of negative mental health outcomes, including suicidality. However, despite these benefits, like many health services, there are barriers to accessing gender affirming care in Canada, including long wait lists, fear of discrimination from physicians, and a binary understanding of gender and transition, which is not inclusive of the growing number of youth who identify outside of the gender binary. These barriers are, of course, exacerbated for gender diverse youth who are racialized or Indigenous. When gender diverse youth are able to find trans-competent physicians and reach the top of those long wait lists, their experience of gender affirming services varies. In preparing to write my engagement plan, I reviewed several articles which engaged youth as experts in their own care and experiences and generated recommendations for how these services could serve them better. Including more education for physicians or clinicians, bringing in an intersectional lens, and creating an inclusive care environment. As mentioned, my practicum took place at Foundry, where I'm also privileged to work. For those who don't know, Foundry is a network of 17 youth health centers with 16 brick and mortar centers spread across the province and a virtual service accessible through a smartphone app. I've included a map of all the centers here and a photo of the beautiful Foundry Center located on Yates Street in Victoria. Foundry's vision is to transform access to services for youth ages 12 to 24 in BC, and it does so by providing low barrier, integrated health and social services, including gender affirming care. Now, as a non-binary person who accesses gender affirming care myself, I'm biased, but I think it's a great time for Foundry to engage with gender diverse youth about their experiences of gender affirming care. First, Foundry regularly engages with youth and families to seek feedback about its programs and services, and co-creating experience is a core pillar of the organization's service framework. Next, this engagement is very timely. Several Foundry centers in the network have been open and offering gender affirming care for a few years, yet to date there has been no formal evaluation of these services, which leaves us wondering whether or not they are still meeting the evolving needs of gender diverse youth. This project is also timely given the current political climate, in which we have politicians running on platforms of so-called parental rights and denying gender diverse youth the opportunity to choose what is best for themselves. By giving youth the power to lead a project such as this and shape services, Foundry is directly counteracting this hateful rhetoric. Lastly, and most importantly, this engagement project can have multiple benefits for gender diverse youth in our province by creating opportunities for youth to shape services, gain research skills, and ultimately improve the quality of gender-affirming care for youth in BC. To develop my engagement project plan, I drew on Hart's ladder of child participation as well as youth participatory action research. Hart's ladder, which is pictured on the right, depicts a typology of children's participation in projects, going from manipulation at the bottom to child-initiated shared decisions with adults at the top. This ladder was developed with the intention to support adults like me who wish to collaborate with youth and meaningfully involve them in projects. I bolded step 6, adult-initiated shared decisions with children, as I feel it most closely describes my framework. Next, participatory action research, and specifically youth participatory action research, or YPAR, aims to engage youth as co-researchers and focuses on creating community-level change for equity-denied youth. YPAR has also been shown to have positive impacts on youth researchers themselves. Given that gender diverse youth experience high rates of mental distress and may not have the same opportunities to contribute to their communities as more privileged youth, it just made sense to choose a methodology that would leverage the lived experience of gender diverse youth to improve services while simultaneously fostering individual and collective well-being. For all the reasons I've discussed so far, it's important to me that this project is youth-led. To do so, I recommend recruiting and supporting a Youth Research Advisory Committee, or YRAC, of 5 gender diverse youth ages 16 to 24 who have accessed gender-affirming care at Foundry. Together with staff from Foundry's provincial office, this committee would lead the engagement project, including doing recruitment, facilitating engagement activities, analyzing results, and producing recommendations for service improvements. Here's a high-level timeline for the proposed engagement project, which would be refined by the RIRAC. After some pre-planning, the project would kick off with recruitment of the youth advisory. Then I have built in plenty of time for relationship building with the advisory, as this is key for building trust and navigating issues of power. Then engagement sessions would take place in spring 2026, ideally with around 15 more gender diverse youth from across the province who have accessed gender-affirming care through Foundry. These sessions could take multiple different forms and would be determined by the advisory. For example, the YRAC might lead participants in a photo voice project about their experience of accessing gender-affirming care through Foundry, followed by a group discussion. Following these engagement sessions, the YRAC would collaboratively analyze the data and produce recommendations for improving services at Foundry. While I have designed this project to be as low barrier and inclusive as possible, there are some barriers which could hinder gender diverse youth from participating. For example, should I be chosen to co-lead this project, my whiteness may mean that some BIPOC youth hesitate to engage due to ongoing and historical harms inflicted by white researchers and service providers. To navigate this, I have applied the recommendations from Young and colleagues who wrote an excellent paper about navigating power in YPAR projects. These include making space for relationship building, setting clear expectations, and creating youth-only spaces. I also recommend hiring a BIPOC person to co-lead the project, as well as creating identity-specific groups or engagement, such as a group just for gender-diverse youth who are Indigenous. One of the core principles of youth participatory action research is that research, or engagement in this case, leads to social change, which is why I've included knowledge mobilization into the project plan. The YRAC will be supported to create knowledge products that capture the learnings of the engagement that we can then share back with decision makers at Foundry. I'm particularly interested in using an arts-based format for this, such as a zine, as art captures what is difficult to put into words. Following the conclusion of the engagement project, it is my sincere hope that Foundry would then apply these community-derived insights to improve gender-affirming care at Foundry centers and ensure that even more youth have access to this life-saving care. Thank you for listening to my presentation, and I'm happy to take any questions.